Welcome to the Rushcast from Rush University System for Health, one of the nation's leading academic health systems. Today we talk with Dr. Latania Logan, Chief of Pediatric Infectious Diseases at Rush, and Dr. Louis Kraus, Chief of Child and Adolescent Psychiatry at Rush. The two discuss what parents need to know about coronavirus and kids.
Dr. Logan, Dr. Kraus, thank you for joining us at the Rushcast.
Yeah, thank you for having us.
So it is March 16th, and we're into serious coronavirus mitigation or attempts at mitigation. Social distancing is now a term that many Americans are becoming familiar with. And kids are in Chicago and in the state of Illinois are no longer going to school, and that's the case with many states. Today we'd like to talk about kids and COVID-19 and what parents should know about COVID-19 in context of their kids. And Dr. Logan, maybe let's start with you. What should parents know about COVID-19 as it relates to children?
Okay, well, this is a very important question for parents to understand because they are the first line of information, or at least accurate information, for their children. So it's important for them to understand this so that their children can fully understand what is occurring. So coronaviruses actually are common viruses that we see during the respiratory season, which is usually the colder time of year here in Chicago. And those viruses are simple cold viruses. Normal coronaviruses usually cause mild disease in people, meaning a cough, cold, maybe some mild fever-like symptoms, and they are not normally the ones that make people very sick. But this novel coronavirus is one that's called novel because it's new, meaning none of us have ever been around it, none of us have ever seen it. The issue is that this virus is different from other viruses in that the people that are getting sick from the viruses, the majority of those people aren't going to have any symptoms, or the symptoms they have are mild. Again, cold symptoms or flu-like symptoms. But if you're an older adult who's over 60, or you're a person who has problems with breathing, like lung disease or heart disease or maybe diabetes, you're probably going to have a more severe illness from this than someone who doesn't have those conditions. And children fit into that group of people who are going to have mild symptoms because they're generally healthy, they're young, and they're able to get over these viruses quickly.
Is there a feeling that they're around so many different types of viruses and diseases that their immune system is kind of better equipped as we get older? We reduce that?
That's a great question. That's very interesting. We're still learning about it, but we actually tend to refer to children as shedders and spreaders, meaning the virus tends to come and sit into their noses and into their bodies, but you don't see necessarily that they're sick. However, it doesn't mean that they can't spread those germs. And what do children do? They tend to do things like not wash their hands properly, or maybe not wash their hands at all. They tend to touch their face and others a lot. They are one with the environment. So this is why they may be more likely to give this to someone else, but to not get as sick from it. There's another thought that there's a specific receptor in the body that is not as mature in children that this virus actually may bind to better once you get older. And so because children have more immaturity to that receptor, they may be less likely to get severe disease from this virus. But again, recognize other than certain flu viruses, most viruses are pretty mild illnesses in children.
Hand washing is important even when it's not flu season, but it's a challenge with little kids. What's the best way for kids to wash their hands that you could tell parents?
Well, one thing that we did here, and I encourage you to watch, I had fun with our lads preschool kids here at Rush, and we'd made a video on how to properly wash your hands. And one of the things that's nice to do with children is sing a song to washing hands. And you want to do one that takes at least 20 seconds for them to be able to scrub and rub their hands. what I like to use is a song that's called Tops and Bottoms, which I won't bore you with right now by song, but it's sang to the Farajaka or Are You Sleeping, which is a slower kind of song, and it teaches you to wash your tops and bottoms and in between and scrubbing them all together. So again, it's fun things for kids to remind them, just like when you're brushing your teeth using a nice fancy looking toothbrush, or giving them fun songs to sing will help them to encourage them to wash their hands. You also want to encourage them to think about what they're touching and to make sure they're not touching as many things too. So opening doors with a sleeve or your jacket or a towel or paper towel when you're coming out of the bathroom, so less touching of objects and less touching of other people and other people's objects. So it's not as simple as just washing your hands, but making sure that you're not contacting a lot of the environment and a lot of other people.
So how often would you say to a parent that their kid during the day should be washing their hands, or the circumstances, I would imagine?
That's a great question. I think basically if you're getting up and moving to another part of your house or to another part of your school, the likelihood is that you are probably going to contact something else in that environmental setting. So if the child is sitting working on something or watching a show or working on their iPad, then I think once they move from that, you want to try to remember to wipe down that area with disinfectant wipes. You can keep those at home. There are certain different products that you can use, wiping off their iPads, the telephones, and things like that they're contacting. And when they get up, make sure that they are going to that bottle of hand sanitizer and just getting a good rub in. Hand sanitizer is one of the best things you can have around, because at least if the hands...
Except it's hard to find.
Yes, it's hard to find now. Yeah. But if you have one, go ahead and just, keep that around. Give them a little squirt of that or two and let them rub their hands, and then they'll sit down and be ready again.
So you're really describing a level of vigilance that I think a lot of parents they haven't wrapped their minds around it yet. I mean, it's a fair amount of kids move around a lot during the course of a day, but it's a level one might say, wow, there's a level of obsessiveness to it, but we're talking about a life-threatening virus, and so we need to kind of ratchet up what we're doing.
So I think there are two different settings that we're talking about here. Right now, we're at a time where we're encouraging social distancing, which is also going to help what's going on. So social distancing, we're saying try to be not just 6 feet apart from each other when you're outside, but don't be outside. Stay at home when you need to stay at home. Don't have a lot of visitors in your house. Make sure if you are making those moves to go do something, that these are critical things that you need to do. If you're going to the store, doesn't mean your child, if they don't have to go with you, don't take them. So these are measures that are helpful. And in those settings where you're at home, sure, it may be that you're not thinking about washing your hands quite as much as you probably should be, but perhaps maybe you don't need to wash them as much if you're just kind of sitting in one place. Right. But if you're at school,
or you won't be at school.
Well, right. Or if you're going over to someone's house, or you're outside at the store, or even the park, or touching other objects and interacting with the environment or other people, that's when you really need to be much, much more vigilant about this hand washing or hand hygiene, because that is where these germs are going to be spread between the contact between people and the environment.
So if you've wiped down like a play area and the kid has washed his or her hands, I would think it's kind of a safe zone in a way. I mean, as long as they haven't gone outside. If like at the beginning of the day they wash their hands and you really disinfected an area, you'd be in pretty good shape?
I think so. I mean, I think it depends also on how many children you have, because each of the children, depending on their age, little children tend to like to put things in their mouth or, touch things or that sort of thing. And then if they give that to the other child then will spread that. So it's just important to be cognizant of the type of toys also that you have. It's usually better than if you're talking about having a couple books around or maybe electronic equipment than a ball pool where you may be having a lot harder time trying to wipe that down and keep that safe for your children.
Well, that's great. Dr. Logan, you've given us really the infectious disease angle, important information for parents to know. Dr. Kraus, you come at it more from the social emotional angle, and there's a lot that parents are dealing with as we are now needing to spend time with our kids in our homes. Kids don't understand. They want to go out. They want to go to a play date. They just don't get it, depending on the age of the kid. How do parents with kids begin to communicate what's going on with COVID-19?
Well, one of the difficulties for parents is every day or two things change. So the expectations, last week the kids were going to school. There were only a few isolated schools that were closed. You could go to restaurants in the evening. It was really stay away from big crowds. You can go and have play dates with your friends. Now it's different. And one of the difficulties is for parents is that they have to be in tune with their own anxiety. I think kids are going to pick up on parents' anxiety, and it's not helpful at any age. I think that developmentally you have to look at what's going on with kids. So preschoolers are really just going to follow the lead of their parents, and it's going to be kind of tough. You have to take the role of making sure that they're clean. You're going to have to wipe their faces. They're going to be picking their noses and touching their faces and doing whatever little kids do, and you just have to keep them clean as best you can. You're going to keep them in the house at this point. You're not going to have them go outside, and you're going to find fun things for them to do as best you can. It's a lot of it comes through social media, comes through the television, comes through board games. A lot of parents are finding they're opening up the closets and pulling out games they haven't played with their kids in a long time. So you can also take advantage of finding family time with them. As the kids get older, though, the questions start to develop. So, for example, elementary school age kids, they're going to start to wonder what's going on. They're going to wonder if they're going to get sick. They're going to wonder what's next. Why can't they play with their friends? They're kind of happy about the idea of not going to school, but at the same time, it's up to the parents to find out what's online, what's available from the schools to try to keep them up with whatever they're supposed to be doing. I think that kids have to be reassured that the risk of them getting sick in any significant way is essentially zero. So they shouldn't have to worry about that, but they do need to know that they're potentially a risk for others to get this from them, and you have to remind them about keeping themselves clean. Again, elementary school kids, it's not so easy. Middle schoolers and high schoolers, they start to develop better abstract reasoning ability. They're watching the news, they're seeing what's going on, and tend to understand it better, but they will push the limits. Remember, kids, teenagers, they don't feel anything really bad can happen to them. They also don't think about short or long-term ramifications of what they're doing. So you're going to have high schoolers that are going to want to see their friends, want to go out on a date, do things like that, and they'll find ways to try to sneak out of the house. You have to make it really clear this is something you can't do.
How does a parent who's already incredibly anxiety-ridden and trying to deal with it themselves tell a kid why they can't go out and why they can't be doing these things without frightening them too much?
Well, I think you take it a day at a time. You don't take the worst case scenario. You don't tell them the sky's falling. You take it a day at a time. Most families, they're healthy. They're going to be low risk. One of the difficulties really is again in regards to the parents. So who stays home? Can you get a babysitter? Is somebody in the sandwich generation? Do they also have elderly parents that they have to try to take care of and get out of the house? And if they go out of the house, are they at risk for, what do they need to do when they come home and sort of calm the kids? And are the grandkids going to want to make sure their grandparents are okay? And that anxiety. And certainly they can take advantage of FaceTime and other ways of communicating with them so they can see everybody's okay, and you minimize that anxiety. The kids are going to pick up on the anxiety from the parents. I think if you set the time so they have things to do, and it's your obligation as a parent to figure that out. Also, make sure, especially middle schoolers and high schoolers, they're going to want to stay up later and later. Try to keep their sleep schedule pretty reasonable, consistent with what it's been as though they're going to school. And again, I think they have to go on the computer, see what's going on at school, what the expectations. I can guarantee you that there are going to be a lot of kids that don't do that at all, and they're going to think this is just going to be weeks to a month off of school where they don't have to do anything. And I don't think that's going to be the case pretty much anywhere.
As a psychiatrist who specializes in children, what are your biggest concerns?
Well, I think the biggest concern for me is the longevity of what's going to go on, and that there are a lot of different aspects of how this is going to affect families. It's not just the infectious component, the fiscal component, people's jobs, what they bring in. We talk a lot about people that have full-time jobs, but there are a lot of people that are doing contractual work that if they're not working, they don't get paid. And so this is going to be a real stress to families in a variety of ways. And what is the most concern for me is the amount of anxiety that parents have and parlaying it to the kids. And the parents need to take a deep breath. And it's kind of like when you're on an airplane, put the oxygen mask on yourself, then take care of your kids, calm yourself down. The other part is that, you've got kids with medical issues, mental health issues. What do? When do they go out of the house? When do they go to see their doctors? Which doctors can you kind of skip going to? Can you skip going to the allergist? Do you really want to sit in a room with a bunch of people sneezing? Versus do you got to go there to get your shots? And you've got to call your physicians. You got to call your treaters and figure out what the best option is. What can be done through some type of communication over the phone or some other way. Doctors have to figure out what's HIPAA compliant and what's not, but in the end of the day, what's the safest way to take care of their patients, and just stay on top of things. And for parents to take one step at a time, make sure that the issues are being taken care of, and most importantly, make sure that your kids seem okay. Find things for them to do at home. Make sure they're occupied.
Great. Dr. Logan, do you have anything to add?
I agree with what Dr. Kraus is saying. I mean, these are very challenging times. In terms of the length of time people can be out, the strategy is going to be dependent on how long and how much of this community transmission is going on. There's been studies to show that in short term, when you're taking the children out of school and out of these environments, that you're probably not going to affect overall community transmission very much. What is important is that, home isolation, if you're symptomatic, and washing your hands and those types of things we discussed earlier. And I don't think we know when this is going to happen, and I think that is troubling, as Dr. Kraus points out, because of the fact that there are a lot of children who need services, whether they're physical or mental health services, and that it's going to be very challenging for those children to receive that important care during this time. The other issue is you have to understand the socioeconomic divide gets worse during these times. If you are a child who is dependent on meals at school, you can't get those services if you're not at school. So I think that there's a very delicate balance here, and I think it's very important for the parents to stay up day to day on the information and make sure, again, calmly imparting the information that's necessary to their children, but not in a way that's going to create more anxiety than it is for everyone right now.
That was excellent advice. Thank you both for joining us today. And everyone, remember, stay safe, wash your hands, don't touch your face.
Thanks for having us.
Thank you very much.
The Rushcast is a production of Rush University System for Health. For more information, go to rush.edu. Rush. Excellence is just the beginning.